All right, continuing with the vertebral column, Uncivilized anatomy. Just so you can understand more about the names of your body parts and how your body works, check out this entire list for any questions. Maybe you're taking an anatomy course, and these videos can help supplement, what you're learning in your class. Wink, wink. So you're gonna want to watch the first video. We talked about the general overview, the vertebral column. Just before this, it's made up of the 24 movable vertebrae and the sacrum and then the tailbone. Now, your vertebra is made up of 24 movable individuals, like blocks of bone. They're regularly shaped bone. They got a lot of parts, a lot of little structures on them where muscles attach. We'll go into that in more regional videos. Well, let's talk about a typical vertebra in this video. Just the main parts. You have two atypical or abnormal, outside the norm vertebra. This would be C1, C for cervical, and C2. These would be also called your atlas, C1, which holds up your head, like the Greek Titan from mythology, Atlas, who held the world up on his shoulders. You see this on sometimes little figures on globes, or that's why we call a book of maps an atlas. 12 labors of Hercules, he had to hold the world for a minute while the Titan adjusted his robe, and then he tricked him. Anyway, getting off the topic here. Atlas, that's C1, holds your head up. C2 is the axis, because it has this little odontoid process, a little tooth-like process, like an axle around which C1 spins. We'll do a separate video on C1 and C2. The rest of your vertebra, except for some mild alterations in body shape, the centrum, the shape of the centrum, or some elements on the posterior or neural arch elements, are basically the same. You're going to have kind of like a short can, like a little round short barrel of bone. From the posterior aspect of that bone, you're going to get two stubby little processes that stick out. Right? Those little processes are going to kind of join at the midline with some little thin parts, and then they're going to continue out of the back as a large protruding spike of bone, or a process of bone. Okay? This is a basic or typical vertebra. There's a few parts missing, so bear with me. This is the body or centrum, right, of the vertebra, the body or the centrum, or the vertebral body, the corpus. And then those two little stubby projections that come off the back are called pedicles. Pedicles, not pedestals, but it's similar enough to pedestal. When you stand up on a little pedestal, that might help. Projects out two pedicles. The two pedicles are then going to thin out and move toward the midline with these thin little sheets called the lamina. And the two lamina are going to join at the midline and form a process that goes toward the posterior aspect of the vertebra called the spinous process. Right? The spinous process. Now, interestingly enough, if I put some labels here, this is anterior and superior. So this would be looking at one of my vertebrae from the left while I face this way. So this would be the front. This would be the posterior, superior, and inferior. The pedicles are going to be offset a little bit toward the superior-most aspect of the centrum. They're going to sit up a little bit, and I'll show you why in a moment. And the spinous process that projects toward the posterior. When you have ever felt on your own spine or on somebody's back, those little knobs and bumps that run down their back, referred to as your backbone, really what you're feeling is a series of these spinous processes just below the skin, muscle, and some other subcutaneous tissue, fascia and such. Those little bumps of the spinous process. So when you're feeling at the dorsal surface of your body back here, those little backbone bumps, they're just the tips of these spinous processes. The actual vertebral column sits quite a bit deeper in the torso. All right. So besides those basic parts, pedicle, lamina, and the spinous process, at the junction of the pedicle and lamina. So typically at the junction of the pedicle and lamina, you're going to have another structure that's going to, I know this looks like it's going down, but just imagine it's coming at you 3D. At the base or the junction of the pedicle and lamina, you're going to have two other bony processes that project laterally. And since they go out in the transverse plane laterally from the body, these are called transverse processes. The spinous process and the transverse processes are sometimes shortened to TPs, TP, or SPs. So if you hear me saying TPs and SPs, I'm referring to transverse processes and the spinous process. Okay. So far, so good. Now I'm going to draw another one over here. We're going to look at from a superior view. So if you're looking at the structure down, you're going to have the body, the two pedicles that project posteriorly. They're going to join in the midline with those thin bits, the lamina. And then at the junction of the pedicle and lamina, you would have two laterally projecting in the transverse plane, transverse processes. And then the two lamina meet in the midline and produce that spinous process. SP, TP, TP. So this is what the vertebra would look like from a superior view, looking down. I drew this one, the neural arch or the posterior elements kind of tilted. And let's talk about that too. If I were to draw a line through here, line of division, we're going to refer to the column of vertebral bodies and intervertebral discs. That fibrocartilaginous disc we'll talk about in a minute. We refer to that as the anterior elements of the vertebral column. And then the posterior elements are the pedicles, lamina, and the various bony processes. And you can see it sort of makes this arch off of the posterior aspect of the body. So sometimes the posterior elements are referred to as the neural arch. The neural arch. The neural arch, via the two pedicles and the posterior aspect of the vertebral body, surround a very important structure that is your spinal cord. Right? Spinal cord is part of the central nervous system, and it runs down through, if I were to draw a spinal cord in here, it runs the length of the vertebral column, almost. I'll talk about that in another video. And it's protected along its entire length by the vertebral column. Big stack of thick bony bodies and intervertebral discs in the anterior part, and then it's surrounded on the side by these overlapping pedicles, posterior projections off the vertebra, and the transverse processes and the lamina, which sort of overlap in a plate-like structure and protect the spinal cord all the way down. Now, along the way, the spinal cord is going to release or project some spinal nerves, and we'll talk about that in a minute. I gotta add some more parts on here, but for now, just think of the vertebral column as part of your axial skeleton, along with your skull, which protects your central nervous system, your brain, and your spinal cord. And these are the basic parts of a vertebra that are going to protect your spinal cord: the neural arch or posterior elements, and the anterior elements, which are the bodies. Now I'm going to add just a couple more parts to this. So you got a column. How do these vertebrae overlap and protect the spinal cord? So I'm going to draw real simple 3 vertebrae moving their way down in a series. And in between each, you'll have these intervertebral discs. We'll come back to those in a moment. And then you've got your posterior elements. You have your pedicle that comes out, right, off each vertebra. We're just drawing this from a flat lateral. And then the lamina would happen at this point, and then your spinous processes would be projecting out back. I'm going to leave the TPs off for now, just because they would be projecting out like this, straight out towards you, and I don't want to confuse this portion of my drawing. Now, typically, around where the transverse process is going to project from the pedicle laminar junction, the TP comes out this way. There is going to be a superior oriented bony protrusion and an inferior oriented bony protrusion. Now I know, again, my drawings are startling in their lifelike appearance, but I drew these sort of like shark fins because that helps me remember that on the straight or flat part of the fin is the articular surface of these two structures. Remember, the transverse process is coming out this way and it's on both sides. We'll draw that in a second. These are going to be referred to as the superior articular process and the inferior articular process. Then the inferior articular process will articulate with the superior articular process of the vertebra below, and the inferior articular process of each vertebra will articulate with the one above it. Okay? So these articular processes and their flat or planar facet joints, sometimes called these zygapophyseal joints, are sometimes called facet joints. They are going to orient with each other in a planar fashion. They are synovial joints, so they will have a synovial capsule. They are innervated, they are pain-causing. But you can see that as these overlap down through in the posterior elements, they form another bony column to match with the vertebral bodies in the front. From a superior view, you basically have got the vertebral body, an overlapping series of superior and inferior articular facets on the right pedicle laminar junction, and then one on the left. Okay? So they'll overlap like this, and they're angled in such a way that they sort of support and not only articulate with each other, but support weight and form almost a bony column running the length of the vertebral column. And you'll get a very stable triangle of support. You have these two rear articular processes or articular columns of the facet joints, and then the anterior part of the vertebral bodies as it heads down. Now, the spinal cord, let's talk about that for a second. Spinal cord is running down through that space created by the neural arch that we drew a second ago. It's a terrible spinal cord, but it runs down through there. And as the vertebral body, intervertebral disc, and the superior aspect of the inferior vertebral body immediately below that, let's call these, let's call it T3, T4, and T5. So third, fourth, and fifth thoracic vertebra, just somewhere in the middle. I'm going to leave off the ribs for now, and I've left off, don't forget the transverse process sticking out this way. We're just going to talk about some relationships of this space here. Now, there's a space defined by the vertebral bodies and intervertebral discs in the front. Let's use another color. In the anterior aspect, there's a space there. Now, the inferior aspect of the superior pedicle and the superior aspect of the inferior pedicle. And then in the posterior part, you're going to have the inferior articular process and the superior articular process. That synovial facet joint is going to form the posterior boundaries of this space, which I just outlined in green. And we're going to refer to this as the intervertebral foramen. Right, or foramina. The IVF, right? IVF, intervertebral foramen. The IVF is this space right here when you're looking superiorly, right? And it's bounded, of course, in the back by the articular column, the zygapophyseal joints, the pedicles above and below, and posteriorly it's closed off by the laminar junction in the midline with that spinous process. Right? Now, there are arteries and veins that come in and out of the IVF. Later, maybe we'll do a more detailed video of the IVF. But the main thing to remember is coming off of the spinal cord at the IVF is a spinal nerve. Right? A spinal nerve. It's going to come off right from each IVF spinal cord. You're going to have a right and a left spinal nerve. Spinal nerves are going to exit the IVF all along the length of the vertebral column, there are 31 pair of spinal nerves. 31 pair of spinal nerves. We'll come back to why that's important in a little bit. Right? But this is the relationship in this opening that's formed by the elements of the vertebral column, the neural arch posterior elements, and the anterior elements of the body and the disc. And the spinal nerves are going to exit each of the IVFs. Again, I left off the transverse processes here. This will become important later when we draw in the relationship of the ribs, which come off of each of the thoracic vertebrae, and the intervertebral discs. Not such a big deal in the thoracic, but when you get down the lumbar, and we've got more of an accentuated curve, a secondary curve. If you herniate a disc, it's likely to happen in the low back, and that disc can protrude and impact that spinal nerve where it exits the IVF. So that's why that's important. All right, I'll cut it off here so you can review that, and then I will do the next video on the disc and the body, and we will draw in the costal elements of the thoracic, and then we will go on to the two atypical vertebrae, atlas and axis, and then we'll go down to sacrum and coccygeal levels, and then by that point we're like 8 videos deep. So, okay, check out the next one.